My name is Susan Bushelman. I practice in Northern Kentucky. We are a single specialty group with 5 dermatologists, 1 PA and 1 nurse practitioner. And we have been using EMA since spring of 2014. Meaningful use and PQRS in general is confusing, but last year, I believe was the first year we attested for meaningful use and PQRS with the help of EMA. I think having a partner in EMA makes that so much easier because throughout the year we can go into our reports and check and see where we are. If we're falling short somewhere, then we know where to pick that up, correct it, what we need to do. Rather than having to go through each and every measure, we can just pull up that report. So that's a huge benefit for us, particularly in a practice with so many providers. That's a huge part of it, gathering the data. You guys are doing a lot of work to collect that data, so we don't have to worry about that. When we had paper charts with multiple providers, many of us couldn't read each other's handwriting, so we would have to sometimes go to the nurses of that provider to even figure out what that chart said. So that has been huge, just being, having the data more clear and more available. Being able to access it wherever we are is wonderful. It's great when we're at the office, but patients have questions after hours, whether it be about their care or refills, and so being able to access that wherever we are is also a big benefit for us as well. Really change the way we practice. From a patient care standpoint, I think having the records be accurate and accessible is probably the biggest benefit. So from a business standpoint, probably the compliance. From a patient standpoint, the access. It's also helpful that EMA has some templated things, which of course I was able to tweak for my own practice, and each of us were. Counseling, for instance, if I want to say it a certain way, I can put that in my sticky fields, and so then when the nurses click that button, I know that it's in there the way that I want it to be in there.